The Diabetes Prevention Programme is an evidence-based behavioural change programme. What is pre-diabetes? When your blood sugar levels are higher than usual but not yet high enough to be classified as diabetes. However, when in the pre-diabetic range, it may put you at higher risk of developing diabetes in the future.
The programme is aimed at individuals that have been identified as pre-diabetic by their GP practice. To follow, we are going to hear from some people who have completed the programme and from a GP.
As a GP, having access to a structured, evidence-based diabetes prevention programme for patients has been game-changing in supporting them to optimise their health. The success I've witnessed firsthand evidences the ongoing need for such an impactful programme.
Very interested in the how you worked out your plate, the different sort of amounts that you had for the red and the green and all that, which I found very interesting. Portion sizes as well we had to adjust, and things like not picking in between.
A bit of education on reading food labels, where you go into a supermarket and not to be buying products that have a lot of red markings or even orange markings, to keep them to a minimum. At the end of the course, I basically had achieved everything that I had hoped. In the last 12 months I've lost almost 4 stone, and at least 3.5 stone that can be attributed to my education on the proper foods. It became part of my daily routine that at some time in the day I wanted to go for a walk, and I found that after a few weeks that activity became quite easy.
For me it was checking what contains sugars and fats, which I'd sort of taken for granted before that. The doctor told us that we were out of the pre-diabetic zone.
Yes, but that's for both of us, and I got praise for the loss of weight. It's totally worth it. I feel 100% better than I did before.
Yes, me too.
And I don't want to go back to where I was before. Now I recognise where I was before.
I think doing it via Zoom worked very well.
I agree, totally.
A, because of the pandemic, nobody felt uncomfortable, but B, doing it in the privacy of your own home. You also, it was only an hour you had to allocate to the call, so there was never a question of having to charge out in the weather or whatever, and I think it kept more people on the programme.
The 9 months really flew by, and I don't think it could be done in a much shorter time.
Really recommend it.
Totally recommend it.
I wouldn't call it a programme so much as a lifestyle change, to be honest. It's something you should seriously think about doing.
I would thoroughly recommend this programme to anyone who has any threat of diabetes. In fact, do it before you get to that length, and once you start into this and get your mindset right, you'll find the programme is quite easy.
I commenced the programme in the year 2019. I lost weight, I reduced my HbA1c, I exercise more frequently now, and I am more aware of what I'm eating and what the calories in it, what the sugar intake is and what the fat content is. I now read labels on food that I'm picking up in the supermarket. Maybe 6 days a week I do exercise, I walk maybe 4, do 2 nights in the gym, and I take 1 night off a week. My husband was also pre-diabetic. He started the course the year after me, and he's just completed his, and we're both now aware of our eating habits, and less sugary stuff, less chocolate, and he himself is out exercising as well. I have done other programs before where I've tried to lose weight, and that was fine for a while, but then after a few weeks, because the weight wasn't coming off, you just seem to say, oh, well, this isn't working. With the diabetic course, I was able, it came off slowly, not big amounts at a time, small amounts at a time, just chipped away, and that's how I had a good weight loss, which I was delighted